Welcome to VHA Excellence in Healthcare with Dr. Ryan Vega, Dr. Elena Seckel, and your host, Jacob Gadd. Today's edition, Diffusion of Excellence.
Hello, I'm Jacob Gadd. Welcome to VHA Excellence in Healthcare. My guests today are Dr. Ryan Vega, Diffusion of Excellence Lead from the Richmond VA Medical Center, and Dr. Elena Seckel, Associate Chief of Pharmacy and Gold Status Fellow from the Madison VA Medical Center. Welcome to you both. And Ryan, so let's begin with our first question, and that is, tell us a little bit about the Diffusion of Excellence initiative, how it started, and how you, where the program currently is today.
Yeah, Jacob, thank you. So the Diffusion of Excellence was an initiative started by Dr. Sharif Ellenhall a couple of years ago. And really, at its core, the concept is how do we spread promising and best practices across VHA, understanding that we're the largest integrated health system in the country, separated from geographically by sometimes very large distances. And it's the simple model of how is something that's going on in Alabama impacting veterans replicated in California or Virginia and Washington. But I think truly at its core, what it really is it's a model and a mechanism for us to allow frontline talented employees like Elena to tackle some of the tough challenges that the VA is facing, come up with the solutions, and connect them across the enterprise, so to speak, to really impact the veteran experience and to make sure that that is standard across sites. And so I think really that's really the novel and the innovative aspect of it is it's building that network, right? Really promoting and elevating frontline employees who are in the trenches, who see the challenges. Mm-hmm. We sometimes, leadership sometimes are discussing them. They're the ones with the solutions and the answers. So go to them and allow them to kind of solve some of these challenges and spread those initiatives across the health system.
And it was based off of the ABC Shark Tank. So tell us a little bit more about how the Shark Tank actually is part of the program.
Yeah, so we just finished our third Shark Tank. And it's a really great concept because I think it's something that everybody can sort of rally around. The other thing that's really unique about it is it brings some of the leadership into it. So the medical center directors are the sharks. They're the individuals who are bidding on these. Mm-hmm. We started this year with 356 applications. And that had to be funneled down to 19. And 19 practices were allowed to present. They give a 2-minute pitch video. And then the sharks, the network directors or the facility directors, will bid on these projects. And they'll bid using their facility resources. So maybe it's a full-time equivalent or a faculty support, or maybe it's money or resources to support the initiative. And so from there, 10 are selected to be in the gold status fellows or implementing fellows. We just finished our summit a couple of weeks ago up here in Washington, D.C. And that's where we bring these gold status fellows and these implementing fellows together. Mm-hmm. And right now, those implementing fellows are back at their facilities. They're working on implementing these promising practices. And it was really just an amazing experience to see. The breadth of the initiatives are aimed at suicide reduction or opiate safety, new models of care for home-based primary care and reducing readmissions, mm-hmm. And the excitement and the passion that the front line brings to really improving the veteran experience. It's just infectious to be around. And I'm excited to hear from Elena today and just our brief discussion earlier. You really can tell how powerful this initiative is.
Absolutely. And Elena, as a Diffusion of Excellence finalist, tell us about your experience with the program and what your program actually was.
Yeah, thanks. And I just have to say thanks to both Ryan and Jacob for having me here. It's a testament to the opportunities that I've been given through being in the Diffusion of Excellence I would have never had as a frontline employee in another way. So my experience, I'm a frontline employee at the Madison VA. I see patients in clinic as a pharmacist provider. Once patients are diagnosed, pharmacist providers can take them over. So we see things like diabetes and blood pressure, cholesterol, hypothyroidism, osteoporosis, anything that's chronic, mm-hmm. that has medications as the primary therapy, we can take over. And so as a veteran care provider, when the call out for the Shark Tank Tank first came, I thought, well, we've been able to show the impact of pharmacist providers shifting those appointments off of primary care providers and onto pharmacists, and show that it opened access by 27% and really took our wait times down from greater than 30 days down to 2 days for our patients. So we had actually already had that written up as just a project we had done, and so it was very easy for me to copy paste and submit that to the Shark Tank. And then as Ryan is talking about the Shark Tank, it really makes me reminisce about my time in competing in the Shark Tank as part of the first cohort. And our first call out, it was quite interesting because when the email came to submit the strong practices, that was the first time that I'd ever been exposed to this way of doing business in the VA. And I remember thinking, when did the VA decide to try to be fun? Was really my experience and my sort of interpretation of the program. Anyway, submitted it and really forgot about it. And a few weeks later got an email that said, congratulations, you've made it to the top 40. And I thought, of what? I really didn't remember submitting anything. And I actually almost deleted the email until I saw at the bottom it was signed by Dr. Shulkin. And I thought, well, maybe I should take a second and read through this. And then it was a couple weeks of whirlwind competition. We had a telephone interview and a video pitch, and again, so different, the speed at which this was operating than anything that I had experienced in VA before. It was so much faster than any sort of change that had happened before. And then as I'm sitting in the basement of my hospital after we made it to the Shark Tank, and just like Brian was saying, it's medical center directors, VISN directors, leaders in VACO that are on the line, and you're over Adobe Connect, and you've got 3 slides and 2 minutes to give your pitch, try to convince people this is worth implementing at another VA. And after a couple minutes, gave my pitch, was waiting, nothing was coming through. I was hoping, and then finally some bids started coming. And we got some bids from the El Paso director at the El Paso VA and was paired with them to implement at their site. Ended up going to El Paso VA twice before we were selected for national rollout, and we've since been to 8 more sites and have 20 more sites slated for fiscal year 18.
It's exciting just to be part of the initial, application process and to become a finalist. What do you think is the biggest benefit to veterans from that program?
I think it's twofold. One being increased access, that's the primary piece. Improved veteran satisfaction going along with that, from getting in to be seen. We've had patients come back and say that this is so much better than putting up with normal delays. I had one patient tell me I was their tobacco angel because I'd helped them quit smoking. And we've also seen improvements in quality outcomes as well. Ryan mentioned this earlier. So we've been able to show improvements in A1Cs greater than 9% going down, blood pressures above goal, patients with cardiac history not on statins and now are. And so we've been able to not only see increased access for veterans, but they've also been happy and have been getting better clinical outcomes as well.
Perfect. And so congratulations. It's an amazing project, but one that continues through this program. And so what would you tell a VA employee that has a best practice or an idea that wants, that may be interested in participating? What advice would you give to them? And Ryan, we'll start with you.
Yeah, it's a great question. So I think one of the biggest challenges we've seen in healthcare is how do ideas and innovation spread? And I was reading an article earlier about anesthesia and antiseptic. So 2 different innovations that occurred, years and years and years ago. One of them spread quickly and adopted quickly, and one of them didn't. And I think the gist of what we're starting to understand is that the reason things sometimes move so slowly in healthcare is because we don't try to really understand why individuals are having barriers to implementing, why individuals aren't interested in adopting something. What are the cultural norms and challenges? This is different. This is aimed at addressing those very things. This is aimed at going to the front line and saying, we recognize that you're in the trenches, you have the solutions to some of the big problems we have, and we're going to support that. And I think that mentality is different. It's a cultural transformation. It's really helping us move towards being a learning health system and some of the core tenets of high reliability. So employees that are interested in getting involved, I think whether they just submit an application and never follow up, or whether they go all the way to being like one of our superstars, Elena, this is different. This is making a difference for veterans. It's changing the way that we deliver care. And I think it's something incredibly exciting to be a part of. So I would encourage them to get involved any way they can. We have diffusion leads in each VISN. They can contact myself, they can contact some of the gold status fellows who are around, and take part in this, because I think we're seeing the impact it's having. And I think it's something that in years to come we're going to look back and all be very proud of.
That's fantastic. And Alina, from your perspective, what advice would you give to a VA employee?
Yeah, I'm proud already. I mean, I think that everything Ryan is saying is so incredibly genuine, and it's truly supported. This has been an opportunity that as a frontline staff employee, not only is there recognition for being able to implement a project and track the outcomes to improve veteran care, but it's also truly supported by resources and facilitating implementation, help with facilitating in El Paso. It wasn't just me going by myself. There was another person from the Diffusion of Excellence team that came, and she helped throughout the 6-month process of implementing at El Paso, and then we got a grant through the Diffusion of Excellence program to continue to go to these other sites. So it's really, I think, so important for frontline staff to see that it's real, that it's genuine, and that we all have a responsibility to submit these projects and these practices, because ultimately it's about improving veteran care.
Right.
And it starts really at the top. I mean, Dr. Shulkin, who's of course now our secretary, this was one of his main initiatives as undersecretary, and he has been a stark advocate for our frontline staff throughout this project and beyond since that time. I mean, that's where I first met Jacob. He and Latrice and Dr. Shulkin came to Wisconsin last year. He was the keynote speaker at the Pharmacy Society of Wisconsin meeting. He actually, a fun fact, he told me his grandfather was the very first pharmacist to ever practice at the Madison VA.
Right.
So it's kind of a neat connection there. But he's just been so supportive and will advocate for any frontline staff that are making a difference to help improve veteran care.
Well, I want to thank you both for taking the time to talk with us today, and also to our VA employees, that we need your ideas and your innovation, and if you want to participate, definitely and learn more about the Diffusion of Excellence program, get involved at your facility. Again, want to thank you for watching today. Join us for our next edition of VHA Excellence in Healthcare. Thank you very much.
Join us for our next edition of VHA Excellence in Healthcare, when our topic will be Excellence and Integrity. VHA Excellence in Healthcare is produced by the U.S. Department of Veterans Affairs.